Good day everyone, and welcome back to this session. In this video, we will continue our discussion on foundations, chain of survival, and CABD sequence. Before that, let's look at our previous lesson. In our previous lesson, we listed and explained the 6 links of the chain of survival, including recovery, and we also demonstrated the CABD sequence in the correct order. By the end of this lesson, you will be able to perform scene safety and initial assessment, including responsiveness, breathing, and pulse check within 10 seconds, and state the correct next action. Activate emergency response appropriately, including 112 in Nigeria, and demonstrate basic teamwork and communication during emergencies. Now let's look at how infection prevention is applied during resuscitation. Infection prevention is important because rescuers may be exposed to blood, saliva, vomit, or other body fluids during resuscitation. If no barrier device is available and rescue breaths cannot be given safely, compression-only CPR should still be started rather than delaying all care. In simple terms, rescuers must protect themselves without delaying life-saving action. Important infection control steps include using gloves where available, wearing masks and protective eyewear where possible, using barrier devices for rescue breathing, washing hands or using sanitizer after care, avoiding contaminated surfaces if possible, disposing of used materials safely. Note: infection prevention is important, but it should never stop urgent chest compressions from starting. Next is, how do communication and teamwork improve resuscitation? Good resuscitation depends on teamwork and clear communication. Teamwork helps reduce confusion and improve survival. Important teamwork principles include clear role assignment. One person may lead while others perform compressions, call for help, attach the AED, or document. Closed-loop communication. Instructions are repeated back to confirm they were heard and understood. Example: leader, start compressions. Rescuer, starting compressions. Situational awareness. Team members stay aware of the patient's condition, timing, fatigue, and next steps. Mutual support. Team members help each other, rotate roles, and anticipate what may be needed next. Effective handover. When advanced help arrives, report. What happened? Time of collapse. Actions already taken. Patient condition. Known medical history. Note: good resuscitation is not only physical skill, it also depends on communication skill. Now let's finally look at what ethical and legal responsibilities apply during resuscitation. Resuscitation must be carried out ethically, legally, and professionally. Important ethical principles include beneficence, which means act in the patient's best interest. Non-maleficence, which means avoid unnecessary harm. Autonomy, which means respect the patient's wishes, including valid DNR orders. Justice, which means treat all patients fairly. Legal and professional responsibilities include using implied consent in true emergencies, acting within your level of training, following institutional and national guidelines, documenting times, actions, and outcomes accurately, maintaining confidentiality. Note: ethical and legal awareness protects both the patient and the rescuer. In summary, in infection prevention, protect yourself with personal protective equipment and hygiene, but never delay chest compressions. In teamwork and communication, Clear roles, closed-loop communication, awareness, and mutual support improve outcomes. In ethical and professional care, act in the patient's best interest, follow guidelines, respect rights, and document properly. We have come to the end of this session. Thank you for watching. See you in my next video.